Today we will be demonstrating the wound care procedure. Your first step is to check your doctor's notes, and you will be looking for your doctor's orders with regards to the patient's wound. You need to ascertain the dressing material which will be used for the wound. Second step, you will check your nurse's notes. In the nurse's notes, you will be looking for previous wound dressing, the time it was done, day it was done, and the nurse's observation of the wound.
Good afternoon. I am Nurse Smith. How are you today?
I'm fine, thank you.
Great. I am here today to perform a little procedure on you. It is your wound dressing in your abdomen. Can you remind me of your name, please?
Caitlin Williams.
Great, Miss Williams. And your date of birth?
29th of April 1950.
Okay, Miss Williams. Miss Williams, sorry. So today, your dressing would require me to expose your abdomen and assess your wound and clean it as well. Have you ever had this procedure performed on you before?
Yes.
And was it very painful?
No.
Did you tolerate it well?
Yes.
Great. So would you grant me permission to continue with the procedure?
Yes.
Okay. So I will be right back while I gather my equipment. But before I leave, I would like to place you in an appropriate position. I will lower the bed when I return, and I would also need to ensure that your bed is locked, which it is, and it is also positioned at a comfortable height for me. I also want to ensure that your windows are closed and all fans are turned off, sorry. Also, there is enough room here for me to maneuver my equipment when I return. Okay, I will see you shortly.
Okay, thank you. Equipment needed for cleaning your trolley will be an alcohol-based solution, a basin, gauze squares or cotton, whichever is available to you, your trolley, and a bin. Your first step is to clean the point furthest away from you and the topmost part of the trolley. Remember, during this procedure, we are using the one wipe and throw method. Once you're finished cleaning the top of the trolley and the front of the trolley, then we're going to move down to the second layer of the trolley or second shelf of the trolley and continue with the same one wipe throw procedure as well as the furthest point away from you. Once you've finished cleaning your trolley, remember to replace all used items. Items needed for wound dressing: your dressing pack. Remember to check the label, expiry date, autoclave tape, and the integrity of the pack. Also, you will need your gown, sterile gloves. Remember to choose a size suitable for you and the expiry date, your face mask, tape, scissors, and the prescribed cleaning solution. Additionally, you will need your bin lined with a red biohazard bag.
Okay, Miss Williams, I have returned to continue your wound procedure.
Before you enter the room, remember to perform your surgical hand washing. When you enter the room, remember to position your items in a triangle. Your dressing trolley should be placed in front of you. The patient will be at the side and your bin at the foot of the bed. If you are right-handed, your trolley and bin will be placed on the right side of the patient, and if you are left-handed, your trolley and bin will be placed on the left side of the patient.
My assistant now opens the outer part of my dressing tray. She opens the top layer and pulls it over, and then she opens both sides folds. The last one she opens is the bottom fold. Next, my assistant proceeds to open my sterile pair of gloves, which she is going to place on the inner sterile seal.
Don your sterile gloves. Discard the inner packaging of the glove pack and open the inner dressing pack. Check your steam clock. Ensure the black line runs all the way through. If it is not, the items inside of your pack are not sterile. Arrange the items in the manner in which you are going to use them. Your kidney dish to your right, and separate your gauze squares. Once you have finished with your gauze squares, your assistant should pour the required solution into one of your galley pots. Before pouring your solution, ensure to check the name of the solution, expiry date, date and time the solution was opened, and the integrity of the container. Open your solution and pour away from the label, ensuring to maintain sterility. Now you can prepare your patient. Ensure privacy. Lower your bed rails. Adjust the bed to an appropriate position. Expose the area of the wound. And remove the wound dressing without causing pain to the patient. Once you have removed the dressing, observe the area for any soiled presentation. Also, observe the patient's wound for documentation. Drape the wound with your sterile blue paper. Drape your patient with your sterile blue paper. You can now start to clean the patient's wound. Using your gauze squares with required cleaning solution, clean the center of the wound first. One wipe and discard. Clean the point furthest away from you. One wipe and discard. Ensure to maintain the forceps method when passing gauze squares to hand.
Miss Williams, are you experiencing any pain?
No. While cleaning the wound, observe the area for any redness or swelling. Also observe the sutures for any dehiscing, and count the number of sutures in the patient's wound. Remember to pat dry the wound once you have cleaned it, and this applies for closed wounds. Use your sterile hand to dress the wound. Once the wound is covered, you can now use tape or the required covering for the sterile gauze. We can now remove the sterile drape. and cover the sterile gauze with the appropriate adhesive dressing. Now we can make the patient comfortable. Replace your side railings and adjust the bed as needed. Remember to perform aftercare of your equipment in the prep room. For wound care of open wounds, remove the outer dressing in the same manner. Ensuring no pain is caused to the patient. Remove the inner packing as well. Observe for any drainage on the inner packing. Observe the wound for color, stages of wound healing, drainage, obtaining a wound swab. Check the expiry date and the integrity of the container. Remove the swab. Apply the swab stick to the center of the wound, moving it all the way down. Once a sample has been obtained, replace the swab stick into its container. Fill in the required information. Drape the patient. With your sterile blue paper. Clean inside of the patient's wound first using your gauze swabs with the required solution. One wipe and discard, remembering to maintain sterility using one sterile hand and one unsterile hand. While cleaning the wound, remember to assess the patient for pain. Assess the wound for redness and swelling. Once you're finished cleaning the wound, pack the wound as prescribed by the doctor. Remember to use your sterile hand to apply sterile dressing. Remember to keep a note of how many gauze squares were used to pack inside of the patient's wound. Once the wound is covered with sterile gauze, you can remove your drape and apply the appropriate adhesive dressing.